remove myself?
Hello, 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 everyone. Happy Thursday. We hope your day is going well this far. My name is Kiera Edwards. I am the founder of Unique Families Journey. And before we begin, I would like to bring someone up to start the presentation. Her name is Dr. Niv. If you guys have any questions during the webinar, please feel free to drop them in the chat, and we will answer them. And I'm going to bring you up now.
Hi, Kiera. Thanks for having me. I'm so excited.
You're welcome.
Great. So, this is a topic that I really love to talk about. Actually, I presented this topic on addiction, I think around 2 years back in one of our summer camps. So, this was pretty exciting. So, I'm excited again to be able to present it to the families with kids. This is so important.
Absolutely.
All right. So, I'll get started without any further delay. Okay. Perfect. So, should I put it like full slide or
Yes,
okay?
please.
Okay, perfect. So as as I was supposed to discuss, so it's today's topic is say no to addiction. So addiction, as you all know, is such a deadly disease or such a deadly practice in our society that is killing I would say entire generations, especially in the 90s, 80s, 90s. A lot of people, especially youth, have perished in the hands of addiction. So in order to stop this, in order to stop the perishing of our youth and the future of the country, it's very important that we educate the children from a young age, as well as the families, so that they are also able to guide them about the dangers and the evils of addiction. Okay, so the next slide would be yes, what we'll be talking about today is what is addiction. I'm going to define addiction. Why take up addiction? So, as everyone knows, it's harmful. So, why do the youth take up addiction in the first place? It's generally seen that the people who get addicted take up this habit at a very young age. Very or not a very young age, like especially in the teens. The third topic I would discuss is what causes addiction, then addictive substances and behaviors, and the consequences of addiction, physical, mental, and social. And finally, I'd like to summarize the entire thing. Okay, so addiction, defining addiction. In the past, we have seen if we heard about someone who was addicted to either like drugs, especially, or even someone who was a chain smoker, I've heard from relatives or friends, oh, that person smokes so much. He or she, whoever that is, cannot control. They can't control themselves. It's such a bad habit. But it's wrong. It's a bad taboo. Addiction is not a choice, it's a disease. It's actually a neurological disorder that is caused by stimulation of certain pathways of the brain. I'm not going to go into any biological details here, but just defining in a layman's language is that addiction is a disease. What actually happens in the disease is that the person is unable to stop eating or drinking or using or behaving in a particular manner uncontrollably. They know it's harmful. Okay, they know it's not worth doing it because the body is getting harmed, but they cannot control themselves. They have full knowledge it's harmful, as I mentioned, but they just keep on doing it. And the person who indulges in addictions is called an addict. So these are some basic definitions that I would like to mention in the beginning before I proceed into the details. So why take up addiction in the first place? As I mentioned, the addicts, they know very well that it's harmful, right? So why do they take up addiction? There are several reasons. One is family history. So what exactly happens there is the child, say for example, they see people around them. It could be their relatives, it could be cousins, it could be either of the parents. They are smoking. They, for say for example, I take the example of smoking. So they grow up seeing people smoking around them, so they think that it's not, nothing is bad about it, right? So it's nothing is serious, they can do that as well. The second reason is depression, if they feel dejected. Especially it happens in case of special needs students. You know, they are frustrated and they don't have often have friends. They crave for company. They want to be included. Okay, or there could be other reasons of the challenges. So they suffer from anxiety. They suffer from depression. It could be a strong reason for taking up addictions. The third and one of the most important reason is peer pressure. Peer pressure means, you know, other kids who are say popular kids in a school or college, they are forming a group where the others want to be involved in there, but you know, it's, they think they are not cool, so they are not including. So the kids who are outside and want to be included, they indulge in certain addictions to be just be accepted in that group. Like you can see this picture, it's funny, I just put it, I like this picture very much. Come on, you can do it, we are doing it, you can do it as well. So peer pressure is a very important contributing factor of addictions, why kids take up addictions. The fourth reason is confusion or lack of guidance. Often what happens, they don't understand what's good or bad at a young age. If they have a mentor, or if in the form of a teacher, in the form of a parent, or even some relative, giving them a proper guidance, right? Like, you know, this is harmful, don't go there, or why you shouldn't take up, why you shouldn't indulge in peer pressure and take up certain like these addictions. Because of the lack of guidance, they just take it up. So these are some of the common, there are other reasons as well, but these are some of the most common reasons why kids take up addictions. So there are different stages of addiction. So there are mainly five stages. The first is experimentation. Experimentation, that means, kids, they want to explore things from a very young age. Even when they're babies, they want to explore new things. When they're teens, they have their friend circle around there, they want to try out something. Say for example, someone has seen someone older trying out, say, a vape, e-cigarette. Okay, they tell their friends, let's try this out. It shouldn't cause us harm, we'll just try out once. That the first step, experimentation, is the worst, means it's the deadliest step. Then what happens, I'm not saying, so out of 10 kids who try it out, everyone is going to develop a liking, but out of 10, maybe 3, they start liking it. They wouldn't have liked it, or they wouldn't have even known about it unless they have had experimented. But now they have tasted it, they start developing a liking, that okay, this does, it's not bad, let me try it out more. And then they start get increasing the frequency. Maybe they started it like once in 3 months, then it becomes once in a month, then it becomes twice in a month, then it becomes once in a week, then every day. And the fourth stage is dependence, when their body, mainly the brain, actually becomes dependent on that particular substance, and the body cannot live without it. If they don't take it, it causes violent withdrawal symptoms. And at this stage, this disease, addiction, becomes full blown and medical help is required. So these are the stages of addiction. I would say that the first step should not be taken. If the first step, I mean, of course, all the kids are smart at middle school, high school level. They are studying science, you know. If they use some common sense, of course, kids are young and they have a proper mentor in the form of teachers. I'm sure there are health classes in middle school. right? So if the teachers talk to them, I'm sure they talk to them about addiction. If the kids remembered them not to try it out, whoever asked them to try it out, they are not friends, to be honest. So that's a very important step, not trying. Okay, so next I'm going to talk about addictive substances. So there are several substances that cause addiction in human beings. So before going to that, I'd like to give a little brief, a little explanation of how addiction occurs. Again, not going into the biological details or neurological details, but addiction will not, you'll see that you don't, say we try thousands of things, we don't get addicted, right? But if a certain substance, not only a substance, it could be an activity, if it stimulates the brain and causes release of a certain molecule called pleasure molecule, we call it dopamine, but in a layman's language we call it pleasure molecule. That pleasure molecule is very dangerous. If it is released, it will create a feeling of euphoria, it will create a feeling of, you know, a wonderful experience, so the person will want to do it again and again, right? So what will happen, say for example, let me give you the example of an activity. Say I love painting, I love to paint. When I sit with my colors and canvas, that molecule is secreted from my brain and I want to continue doing it. That's not harmful, that's actually great. But the same pathway is followed by these substances. How deadly, can you imagine? So cigarettes, you see alcohol here, you see drugs, so they follow the similar pathway of, you know, taking over the human brain. Okay, let me talk more about, I see two comments over here, let me quickly check. Okay, it's you. Okay. Okay, so the first one is tobacco. So tobacco is actually a plant, um, and whose leaves contain the highly addictive nicotine. So
Mhm.
nicotine is actually the chemical that stimulates our brain, and as I mentioned, triggers the secretion of the pleasure molecule dopamine. Um, so the tobacco is actually consumed within cigarettes, in cigars, in pipes. You can see over here, and also as chewing tobacco. And when a person is smoking, it's not only the nicotine that affects the brain, of course it does, that's the addictive substance. It also contains tar. You know what, you know what tar is, right? The black sticky viscous substance which is
Yes,
used in paving.
yes.
That thing is present in cigars. Can you believe that? And not only that, there are some toxic chemicals that are produced by the burning of tobacco leaf that are inhaled during smoking. So each time a person is smoking, they're inhaling not only the nicotine, they're also inhaling tar, which is deposited on the lungs, and these toxic chemicals as well that they're inhaling all the time.
Wow.
And not only is the person who is directly smoking harmed, anyone who is standing beside the person
That they're
is.
inhaling all the time.
Uh, and then this is called secondhand smoking. Okay. All right. So the next slide would be, okay. Okay. So the next generation smoking, that's vaping. It's very popular, as I mentioned previously. It's very popular among middle school students because they're easy to carry. They look like a pen. Actually, I've seen it in one of the stores. I think I was seeing. Just out of curious, I was just curious. As they look like tiny pens. They come in different shapes, really pretty ones. And I've heard from one, actually the principal of our school district, and she was talking, and she said that it's pretty popular among especially middle school and high school children, which is so dangerous. And you know, these cigarettes, yes, they have no tobacco, that's true, they don't have tar, but the chemicals and the nicotines are there, which are equally harmful. So people shouldn't think that vaping, or the e-cigarettes, since they have no tobacco, it's harmless. It's not harmless. It's equally harmful. And another thing I want to mention is that the the chemicals which are present within the e-cigarettes, they could even explode under certain conditions. So it's very dangerous anyways. In the flights, in airports, when they do security checking, e-cigarettes are not allowed because of their this property of explosion.
Mm-hmm.
Okay. So next I would like to talk about the toxic chemicals that are inhaled during smoking. So till now I was talking about nicotine, I was talking about the tar that is deposited on the lungs. Next, this is also pretty serious, the toxic chemicals that are inhaled. You can't imagine what the chemicals are. You know all these chemicals that are used in our, they're poisons actually. Arsenic, they are found in tobacco leaves, and the refining process is not that great. If it's refined, that's fine, but some level of arsenic is found in tobacco leaves. Formaldehyde is found. Formaldehyde is actually used as fixative to restore dead bodies. Minute amounts of formaldehyde is present in cigarette smoke. Hydrogen cyanide. Hydrogen cyanide is a poison, cardiovascular and respiratory poison, which is found in minuscule amounts. It doesn't cause death. It's present in such a small amount, but it's not a nice thing, of course. Benzene, which is generally found in gasoline, it's also secreted during burning of tobacco. Lead is found. Ammonia is actually found in household cleaners. It's also secreted. It's also released during the burning of tobacco. And
Right.
carbon monoxide, of course. Carbon monoxide is a poison of the circulatory system, and it's also
Mm-hmm.
released during burning of tobacco. So you see, it's an entire package of poisons that come with cigarettes. So I think parents should tell their kids from a young age,
Right.
even when they're like before middle school. I think kids should know these before they indulge in any type of uh, addictions or think
Mm-hmm.
about smoking or vaping. Okay, so this I think is a pretty important slide that I wanted to show. It looks scary, but these are the physiological effects of smoking. You can see clearly the comparison. You see the healthy lungs. It's actually pictures from an autopsy on
Unbelievable.
patients. So this is from a healthy person I'm not saying healthy person. It's from a person who is a non-smoker. Okay, so the lungs are light pink in color, and this is smoker's lung. You see the deposition of tar, black. The lungs appear dark and mottled, and there are short term effects as well as long term effects of smoking. The short term effects are cough, it irritates the respiratory pathway and causes high blood pressure immediately. And long term effects are many and really dangerous ones. It causes, I would say, I wouldn't say 90%, but pretty high percentage of cigarette smokers will end up having COPD. COPD means chronic obstructive pulmonary disorder. I'm going to talk about that in the next slide, but it's an irreversible condition. Okay, asthma. It stimulates asthma as well in certain patients. Coronary heart disease, because the arteries are clogged and thickened because of the deposition of tar. And cancers, it's everyone knows that long-term smokers, they a substantial amount of them could, I'm not saying everyone, but a substantial amount of number of them could develop certain cancers, mainly lung cancer, oral cancer.
Right.
Mhm. So I was talking about the COPD. It's the most common disease in smokers, found in smokers. So it's in a very simple way. You see in the above picture, this is a if you magnify a healthy lung, these round grape-like structures are called alveoli or air sacs. This is where the oxygen uptake takes place from the environment. But what
Mm-hmm.
happens in a COPD patient caused by heavy smokers? these bags, they clog together and are destroyed. So this means these alveoli are destroyed and they are not available for oxygen uptake. So you can imagine the amount of oxygen uptake is decreased in the body. So, and in an advanced condition of COPD, it's irreversible, of course. There's no way. So they have to live with an oxygen cylinder, as you see in this person. I have seen in many hospitals. I've been their patients with COPD patients. They are even on the road. They are. I've seen some elderly people. They are wearing this oxygen. It looks terrible. Okay. So, some other cancers caused by tobacco. So, not only lung cancer or oral cancer, you'll see a multitude of other cancers that are caused by tobacco,
Mhm.
depending on the extent of damage to these organs. Okay, the next substance I'm going to talk about is alcohol. Again, alcohol is a very common beverage. 86% of adults consume alcohol. It's a part of our culture. It's for pleasure and relaxation. For celebrations, we have our, men, they love to have beer, especially watching games and stuff.
Mhm.
If consumed in moderation, it's not like deadly, but if continuously ingested or continuously, if a person becomes a chronic drinker, there are
Mhm.
many ill effects. So that's why CDC has created this chart. It's a very interesting and it's an important chart of moderate drinking versus binge drinking. For men and women, it's different. So moderate drinking, one drink a day is fine. For men, two drinks a day up till that is considered moderate drinking when they can keep their sobriety. And under 18, absolutely no drinks allowed. And under certain health problems, also no drinks are allowed.
Right.
And in case of binge drinking means uncontrolled drinking. For women, if they drink more than four pegs, or men, if more than five drinks, it's called binge drinking. And any drinking under 21 is called binge.
Wow.
And this is what the CDC wants to enforce and want the people to follow this, adults, the young adults, especially younger adults. So I'd like to mention the short-term effects of binge drinking. So with moderate drinking, there's no
Mhm.
immediate ill effect, but with binge drinking, there's immediate effect on the brain. So the person become has increased reaction time and increased risk of accidents. That's why if cops can catch anyone who is drinking and driving, they're immediately behind the bars because they are a threat to others. Loss of emotional control. People can say inappropriate things. They don't have control on their speech. They could have slurred speech. Also, loss of consciousness, increased chances of being abused, especially girls. If they lose control over themselves, you know what will happen. Unstable gait, loss of balance. They could risk falls and getting injured. So these are the short-term effects of drinking uncontrollably. So that's why we encourage the parents to talk to the youth, especially I would suggest starting to talk about this around middle or high school or when they're in their mid-teens, what they should do and what they shouldn't do. So long-term effects of alcoholism. So till now I was talking about the short-term or immediate effects. So chronic alcoholism has really bad long-term effects. So you see, but it takes decades. It doesn't happen in months. So say for example, this is a healthy liver. It's nearly brown in color.
Mhm.
In like 10-15 years of regular drinking, um, chronic alcoholism, I would say, the liver is covered with fat. This part is asymptomatic. The person doesn't feel anything. There are no symptoms. But this stage can be reversible if the person, controls drinking and, takes some, goes to the doctor and changes lifestyle, puts on, loses some weight, there's some changes in, adopts some change in lifestyle, sorry. So this condition can be reversed back to healthy. But If they still continue to drink uncontrollably, what happens is the liver becomes cirrhotic. It's called the cirrhosis of the liver, which means scarring of liver tissues. Constant insult or injury to the liver cells causes the scarring. You see these bumps on the liver, these are all like dead tissues of the liver. This liver cannot function properly. And we know how important liver is because all our metabolic pathways, detoxification goes through the liver. So
Exactly.
a lot of the toxins start accumulating in the body because the liver cannot function. And in certain percentage of liver cirrhosis patients, tumor develops, and this is liver cancer. And once liver cancer develops, it's generally irreversible and
Mhm.
it leads to death unless there's liver transplantation. Even cirrhotic liver as well, it's irreversible, and liver transplantation only helps. So these are when a person is drinking, chronic, indulging in chronic drinking, they should remember this diagram, especially children. I showed this diagram to my daughter. Very. I mean, she could be scared. I even showed her pictures of cancer patients. What happens to them if they smoke so much and drink so much. It is very important for kids to know the consequences.
Exactly.
It's drugs. So till now we talked about nicotine, we talked about tobacco, we talked about alcohol, which are sort of a slow killer. They take decades, and they still gives chance to reverse the condition if the addiction is controlled. But drugs are the deadliest of the substances. Drugs, why are they so dangerous? Because they are, they directly damage or they directly interfere with our physiological functioning. That's why we say that all medicines are drugs, but all drugs are not medicines. The doctors are, when we go to a doctor with a disease, they prescribe a certain medication, right? So they are licensed people, they are professionals, they know what drug exactly will treat that condition that we are suffering from. But if not prescribed by a doctor, if we just keep taking random medication, what will happen? It's going to destroy the organs, it's going to destroy the nervous system first. That's what drugs do. You see, all the classes of drugs, they first attack the nervous system. So these are six classes of drugs. I wanted to show this to everyone. That's why I put this table. Depressants, they just decrease the body's response. And people who are frustrated and they want to relax, they take these depressants. Stimulants, exactly the opposite functions. Hallucinogens, LSD. There's some, we know many of the names of these drugs, so these are the classifications. Dissociatives, opioids, and inhalants. So these are the several classes of drugs. These are if you read them, if someone is interested, I could always share this information. And the health impacts, all of them, all of these drugs, if the body gets, becomes tolerant or becomes dependent on them, drugs can kill people in years if not treated. In years, they're not like decades or anything, in years. Okay. So what are the effects of drugs on the, especially on the developing brain? For example, in teenagers where their entire brain is developing, both, you know, anatomically as well as, fine tuning always goes on till age 30, 35, I believe. So when a person is on drugs, what happens? First of all, of course, addiction and dependence happens. The person cannot live without the drugs. There's violent reaction. Okay, there's violent reaction if the drug is not, they don't take that. Just like alcohol, but worse actually. The slow reaction time, especially by the depressants, and poor planning, dangerous behaviors because they become like vandals. they just lose control over themselves if they are not given those drugs. Mental illness, and since the drugs affect, most of the drugs affect nervous system directly, most of these addicts, they suffer from different mental illnesses. They could become, bipolar, or they could become, a lot of conditions could arise because of the drug addiction. Memory loss could happen in severe cases, impaired learning, and of course the entire thing will lead to lower IQ, and they cannot learn. I mean, they have to go to rehab and then get themselves detoxed if possible. If the damage is within a certain limit, they can be reversed to some extent, but if it goes beyond a certain limit, then death is the only way. I mean, they it's very sad, but it causes death. So this is a picture I wanted to share. It's a scary picture, I know, but I wanted to show people, especially the parents and the children who are attending or will be listening to this presentation later.
Mhm.
This is not made, this is actually a real life. This is a real life picture that I took from Google. This guy, this is the picture of a middle-aged guy before the start of addiction, and after 5 years of meth addiction, methamphetamine. Just look at the condition. I don't know how old he is. He could be 45. That's what he looks like 40 to 45. And say if he's 45, he's 50. In 5 years, he's looking like he's 70. Can you believe the extent of damage? And this young woman, she's 31, and in age 34, she looks like 60. So you see the extent of damage. Generally, it's said that if there's severe damage inside the body, you only see one fifth of that on the face. So if the change on the face is this severe, can you imagine how much cellular damage or organ damage that has occurred within the body by drugs? Okay. So I could also there were some slides that were that in those I described about the certain pathways of drug addiction, but I chose to put them aside because that would be too complicated. Anyways, so this one I think pretty much people won't be expecting. Sugar. Why did I put sugar in under addiction? Everyone loves sugar, right? We all love sugar. Kids love candy, ice cream, chocolates. They will hate me for putting this slide up there, but it's true. I'm really sorry. It's true. Sugar has been classified under cocaine. It's as addictive as cocaine because once they have it, it stimulates that pathway of the brain, as I said, secretes the dopamine molecule, the pleasure molecule, and makes one eat the sugar again and again and again. Of course, there are healthy sugars, good sugars, and bad sugars, but no one is really attracted to the good sugars, right? People like candy and donuts more than fruits, right? Okay, so these are the list of the deadly or harmful sugars. Soda. I myself love soda. That's bad though. Donuts, enriched flour or pasta, enriched bread, candy, ice cream, chocolates, muffins. All these things, they are bad sugars. And
Mm, mm,
what
mm,
sugar does to your body? It's all fat. Uncontrolled intake of sugar leads to increased weight, of course, if it's not controlled. And then, of course, tooth decay. If not cleaned properly, it's not always possible for children, to clean their teeth properly. They keep on having candy throughout the day. Or, in school, especially if there's some event going on, they have candy, they have donuts,
right.
muffins. What happens in adults mainly, if adults have uncontrolled sugar, if they have the habit of, you know, eating these type of sugars often, like frequently, they could develop a damage in the heart. The heart becomes laden with fat. Not only the
Yeah.
heart, the liver as well. Yeah, just like alcohol, similar. And then plaques form inside the arteries. Okay, diabetes happens again. Diabetes is not only it's not just only the sugar causes diabetes. There are other reasons as well, but sugar is one of the main contributors, because the our body cannot handle enough if a lot of sugar is taken in. Cancer, yes, with increasing obesity, the risk of cancer increases as well. And osteoarthritis, with increasing weight, there is increased pressure on different joints of our body, leading to osteoarthritis. So it's very important from a young age, from like preteens, to be aware of that, how harmful sugar is. Yeah, I'm not saying that you should stop eating candy, especially during Halloween or festive seasons, yes, but don't eat it every day. Don't eat it throughout the year. Keep it for special occasions. That's fine. But uncontrolled intake of sugar will cause these effects in the body. So avoid junk or bad sugars. If you really want something sweet to eat, have fruits. There are so many nice fruits, sweet fruits. Grapes are beautiful. Mangoes, grapes, these are sweet fruits, and they not only have sugar, these are complex sugar that are not as harmful, and they also have fibers, so they'll help the body in a lot of ways. Okay. Next part is, I could actually give a presentation. This is another big part, behavioral addiction. So this is, I'm just going through this quickly because I don't have a lot of time. I'm actually, I think, running over time. But children or even adults shouldn't take this less seriously, because they are also called addiction. Not only are the substances dangerous, these behaviors are also dangerous. Internet addiction, spending hours at night looking at internet. Gaming, playing games throughout the day, sitting in one chair. You see how the physiological damage. Looking at internet at night, loss of sleep, loss of time. The body is not rested, stressed out. Uh, then the next is binge eating. Binge eating is, it's also an addiction. Continuously eating. It could This behavior could stem from depression as well. Depression or feeling inadequate in certain situations. So this is also an addiction. Impulsive shopping, this is also an addiction. This also occurs due to certain depression or feeling inadequate. Gambling is a dangerous addiction which destroys families and causes loss of wealth, and if loss of social life. So this is another large another big topic that I would like to actually emphasize in a full presentation later. uh, what happened? Okay. So the consequences of behavioral addictions, as I mentioned, of course, wastage of money on useless things, wastage of time, loss of productive hours doing nothing, indulging in like useless activities, loss of wealth and security, and loss of social life, because they are not going out talking to people, but they are just spending time doing nothing and destroying their health as well. So this brings us to sort of the end of our presentation. So I'd like to summarize saying that all these addictive behaviors, uses of addictive substances or indulging in addictive behaviors, it is not a choice. So don't, brand the addict saying that, oh, it's their habit, it's a bad habit, they are incorrigible. No, it's a disease and they need help. So they need the support of the community to combat the addiction. So my suggestion to families, with young kids, especially special needs kids, I don't see any difference. It's just that they have to be told repeatedly, because they're vulnerable. They have to be told repeatedly that avoid company or peers. Say you are feeling sad that nobody is taking you in their group. But if they tell you, okay, smoke a cigarette and you are welcome, avoid such people. They are not your friends. they mean harm. And addiction is not a matter of willpower or choice, it's a disease and it needs treatment. With treatment, with proper rehab, with proper resources, I know I have read about many addicts who have come out of this and leading a normal social life. And there are helplines, get in touch with local helpline. There are doctors, medical professionals, social workers who can help out. And for the youngsters who have not started yet, I would say never start and stay away from those people who tell you to start. So that would be it. So thank you very much for listening, and I really enjoyed speaking about it. There are so many things about addiction, and I could go on and on. I could show you pictures, but that would be scary. I don't want to. But it's good to be scared to a certain extent, actually, and know about the consequences of what will happen if they indulge in these addictive substances or behaviors. Thank you very much for having me.
Thank you, Dr. Niv, so much for coming on. I personally learned a lot. I did not know sugar was an addiction, so I have to cut back on how much sugar I eat. Um, but for those that want to connect with you or get the slides, where can they find you at or learn more information?
I could send the slide. I could send a summary of the slides to you, and you could circulate it whoever wants.
Okay. All right, everyone. Thank you for joining. We will be back on next month. Again, Dr. Niv, thank you so much for coming on. I learned so much. And everyone, enjoy your weekend.
Thank you very much. It was a pleasure. Bye.
You. Bye bye.